Hey guys, welcome back to Talks with Joe. Thanks for joining in. Today we're talking about a recently approved oral testosterone form of the FDA. Seeing these things kind of come up more and more, and as I was kind of going through some research, just what's going on out there with men's health, came across this. Thought it'd be an interesting one. So in a little bit, I'll pull up a share screen. We'll just pull up the documents. What are the warnings, the dosages, the common practices, and things of that nature. So just to kind of get familiar with it. But I found it just interesting as men's health. Some of the stats right now are showing over 40% of men 40 years and older have low testosterone or are suffering from hypogonadal symptoms. And so as men's health becomes more of awareness, kind of you're going to see more and more products like this come out. So I think it's important to stay on top of it, especially if you're more proactive with your health, you're talking to your doctors, you're working with a reputable clinic out there. So you can ask the right questions as far as what type of treatment options you have. I think as you look at administration, some people just don't like to inject. There's a variety of different ways to do it, right? You have your muscular, which is going to be a little deeper, probably not as comfortable. You do subcutaneous. Again, comfort's gonna be a little better than intramuscular, but there's some things with that where some people may not like that as well, or say, hey, I'm not doing injections at all. And then you have creams, and as we'll have in some other videos talking about creams, just some of the things to think about. But just in a nutshell, are absorption, if they rub off on sheets, on partners, things of that nature. So stuff to be aware of. So this is interesting because it's an oral, so just kind of in a pill form that you can take. And I just thought I would unpack the sheet today, walk through it, just do a brief introduction, and then hopefully in the future have some experts come on and just talk a little bit more in depth about this specific treatment protocol. But would love to hear your feedback. What treatment are you using? What method of administration? How's it working for you? And is this something that interests you? Is it something that you would consider if it was showed to be to work and be effective? Would you switch over to oral administration? So let's take a look at it and check it out. I'm going to load it up here. All right, so we got the screen up here now. Let's kind of peruse this guy. Take a look at some of the highlights and things. So as you can see, Kybertrex is the medication. Looks like kind of your standard warnings we're looking at here. As far as blood pressure increase, patient's baseline, like cardiovascular risk effects. So kind of your typical things, right? Like making sure you're staying on top of your cardiovascular health, your blood pressure before you're starting, working with a physician to do that, having a routine physical on an annual basis to stay on top of your health. And just overall looking at, how does this treat hypogonadal symptoms and so on. So as we get into kind of indications and usage, you can see here, it is talking about, let's see, it's an androgen indicator for testosterone replacement therapy in adult males, deficiency absence of endogenous testosterone. So again, the body's not producing enough testosterone, so we're taking it in, through injection, through cream, or in this case, orally. Interestingly, too, a couple things. It's as you go through it, talking about some of the dosage. You can see some of the starting dosage looks like uh, 200 milligrams orally once in the morning and once in the evening, and adjusting the dosage, 100 milligrams once in the morning, maximum 400. So pretty big range there again. And it's looking at, doing based on a serum testosterone drawn from 3 to 5 hours after your morning dose, at least 7 days after starting treatment. So it sounds like the way this one works, generally if you're doing like an injectable, you're doing you're checking your blood work about weeks 5 to week 7, somewhere in that range, give or take, letting it build up into your system a little bit. If you're using like a cypionate, like a slightly longer acting ester, that's kind of compounding on top of itself. Looks like this one's going to, the expectation or the standard of care here is going to be to take testing much, much faster. So it looks like within about a week. So this is going to be something, pretty hands-on and engaged with your provider out there if you're using this medication. And as you can see, it comes in, a variety of different capsule form strengths, 100, 150, 200 milligrams. So wide range there as far as dosing in milligrams, but Again, you're probably in most cases, I would imagine starting off at a lower dose and kind of titrating up as you're monitoring, your response in blood serum and how your body's adjusting to it. One nice thing that might be out there to consider is if you are more prone to estrogen related side effects or just those any adverse effects to that nature. If you were seeing some irregulation in blood pressure or really any kind of unwanted symptoms, you could just adjust your next dosage. You could, looks like based on um, how it metabolizes, like you could stop it sooner, and it's not going to have like that long lasting ester from an injectable. So that could be some benefits there. Again, the milligrams is like a whole new language, right? Because when you're doing oral, the way it's going to be broken down, what's actually going to be readily available in the blood serum, that remains to be seen. Not from this document, doesn't really show that, but it's not really apples to apples when you're saying, well, I take 200 milligrams of, testosterone cypionate from my provider, once a week. Well, now we're talking anywhere from 1 to 400 milligrams orally per day. So again, going to be different ranges and a whole different way to approach it if someone's, switching over to treatment there. So, over again, other things to look at here, polycythemia, which is, the same with any testosterone treatment. Monitor hemoglobin hematocrit approximately every 3 months to detect increased red blood cell mass. So, big thing with that is just, as uh, testosterone goes up, red blood cell count can go up. It just, you really want to work closely with your provider and just look at all your risk factors when it comes to red blood cell count or hemoglobin hematocrit, because sometimes, especially if it's a provider that doesn't fully understand um, how the testosterone works in your body, they can do one of two things. One, they're not paying enough attention to it, or two, they're paying a little too much and maybe it freaks them out. You're getting a lot of benefits, blood sugars down regulated, increasing body mass, better energy, better circulation, increased mood, all those types of positive things that we see from testosterone, cognition, etc. But a slight elevation in your hemoglobin hematocrit, and that can cause a doc to kind of freak out a little bit. But again, take a look at what those numbers are, because one of the things that I've heard a lot of clinicians that are really in this industry and practicing this type of medicine in men's health, for quite some time now. The analogy that I've come to understand is, let's just say, I'm making up numbers, but let's say today your testosterone's at a 250, like your total testosterone, nanograms per deciliter, right? And when you were 18, uh, you were at a four, I don't know, 48 was some of your red blood cell markers, right? And your testosterone was at 800 nanograms per deciliter. So if you were at, when you're 18, you're at a 52 was your red blood cell counts, right? So again, hypothetical here, but let's say now you're down to 49, but your total testosterone is at 250 nanograms per deciliter. So you were at 800 and you were in the low 50s for, um, your red blood cell metrics, right? And now they're a little bit lower. You're in the high 40s, but your testosterone's lower. And now we correct the testosterone, and let's say the red blood cell count follows that. It's really not, um, from what I'm hearing, it's not cause for alarm, because that increase is proportionate to the amount of testosterone that you had when you were 18. You didn't have cardiovascular events back then. Odds are, if you're not, in any kind of high risk category and you're working through improving some of those health markers and you're being monitored, again, it's probably going to be just kind of the body's natural response to increasing the red blood cell count from the testosterone therapy. So things to consider there. Obviously, as you go down, any type of growth agonist in your body that you take, cellular growth, which testosterone will do, it helps cells grow more. If you have cancerous cells, they're going to grow more. So does it cause cancer? No, but if you had cancer, it could cause those cancerous cells to grow more. So kind of makes sense there. You're going through is a couple other things there to monitor your serum levels. Obviously, adverse effects potential for as far as sperm count and things of that nature. So because you are replacing, shutting off your natural production in most cases, most therapeutic doses are going to do that. So something again to monitor and take into consideration with your physician when you're looking at that. Different effects potentially as far as sleep, things of that nature. If you already have sleep apnea, the potential of possibly, causing more risk factors there. and then lipid profile changes. But so this kind of gives you an idea overall, and then a breakdown as far as the drug interactions, where it works. Again, many of them are going to be very similar to what your standard testosterone, uh, injectable testosterone, exogenous injectable testosterone, or your creams are going to be. But just thought this was interesting. Would love to hear your feedback. As I mentioned, a pretty straightforward list in here in regards to uh, risk factors, symptoms, warnings, precautions, and things of that nature. Check it out. I'd love to hear if anyone's using this out there, they're seeing results from it and how it's converting. I'll do a little more digging on it. Like I said, it was a new product. Just thought I would uh, get out there. Just recently approved for treatment. So it's pretty exciting to see new things still coming out for male health. Keep watching the channel. Like I said, I'll have some more follow-up stuff. So be sure to subscribe, check it out, because as I keep pumping out content related to this, my intentions there is just to hope to kind of give back to the health community out there. And if it's something you can apply, awesome. So thanks again for checking me out. Follow me at Talks with Joe. Don't forget to subscribe today. We'll see you on the next one. Thanks.